welcome back. We are back talking about stroke. This week we'll talk about who is at risk, how to prevent it, and how to help those who have gotten a stroke. So firstly, who is at risk? Anyone can get a stroke, but the risk goes up with age, with smoking, with alcohol, and if you have a family history of stroke, you're also at a higher risk. Other risk factors include no physical activity, unhealthy diet, lack of sleep, as well as long-term stress. Medical conditions like diabetes and heart disease also increase your risk of stroke. The biggest risk factor is hypertension, high blood pressure. High blood pressure exponentially increases your risk of getting a stroke. So it's very important to monitor and to manage your high blood pressure. So the good news is we can prevent most strokes. Decreasing blood pressure, managing your diabetes, managing your heart disease, eating healthy, no smoking, no alcohol, all these can help prevent strokes. So how do we diagnose strokes? We talked about all the warning signs. Those help in the physical exam that a doctor would do on someone who is suspected to have a stroke. Other things we do is imaging, so a CT scan, an MRI can show if someone has a stroke. So treatment for someone who does have a stroke is dependent on the type of stroke. We talked about an ischemic stroke, the one that is caused by a clot or a blockage of the blood vessel. And with that, the treatment would be a clot buster, or medication that removes or decreases your chances of getting clots. With a hemorrhagic stroke, that's the type with the bleeding, the treatment is to stop the bleeding as well as to remove any blood in the brain that could cause an additional stroke. So the main thing to remember is that there are different types of strokes, different types of treatment, but the treatment for a stroke is mainly to prevent additional strokes. Like we talked about, strokes cause dead brain cells, and therefore bringing them back to life is not possible. And so all of our treatment is geared at preventing additional strokes and removing the cause of the stroke. So recovery from a stroke is very important and takes a very long time because it's brain cells that have to be rewired. What the brain needs to do is create new connections to be able to do a certain thing. Now, it's important to note that most people will not recover completely and go back to the original state. However, treatment is geared at increasing their daily living functionality. So recovery includes physiotherapy, occupational therapy, speech therapy, support, and new ways of doing different things. Remember, recovery is easier if no one faces it alone. Like we talked about last time, if you notice any of our warning signs, seek medical advice immediately. If you or anybody you know needs more information about stroke, please feel free to let us know and look out for the quiz. I'll see you next week.